Methylene blue. I thought I had done a video on this, but I apparently just wrote down my notes and then didn't do the video because I can't find it in my profile. So, methylene blue has been used for a lot of different things. It can cause those really bad cells to die off. But there are people who shouldn't take it. So if you have a G6PD genetic deficiency, you shouldn't take it. Some people with kidney disorder will also struggle with the regular dosing of methylene blue. If you are somebody who has had mood instability, and especially if you're on an SSRI, methylene blue would not be the right medication for you because it can cause serotonin syndrome. And if you happen to be on any meds for mood disorders or psychiatric dysfunction, methylene blue is actually contraindicated because they do interact in a not so positive way. Methylene blue can also increase the likelihood that you have excess sweating, which again, if you have kidney dysfunction, we want to be careful with dosing of methylene blue. It will make you sensitive to sunlight, so you're more likely to burn, and it can create some pulmonary edema in some people. So methylene blue overall has been shown to be super positive for helping the mitochondria and destruction of what they call senescent cells, or cells that are out to do harm. But there are people who should not take it. Just like everything else, you have to know your body and what's going on with your body. And then there are different forms of it. So there are people who will buy like a nebulizer off Amazon for $60, and they will get the liquids and they'll dilute it even further and put it in a liquid and nebulize it. There are people who go to clinics that do IV infusions of it. And then there are oral administrations of it. On this app, there is someone pushing one that you like, it's drops that you use that you put in your water. This brand has some for fairly inexpensive that's pretty high quality in strips that were like the Listerine strips back in the late 90s, early 2000s. There are other companies that have it in a capsule that you would take the capsule, and you can choose how you want to do that. But if you have ever been diagnosed with anemia and you are not sure that it's related to a G6PD deficiency, don't use this product.